Hello again and welcome to part 3 of our lecture series on vascular ring anatomy. In this video, we will be reviewing both the right arch with mirror image branching and the right arch with an aberrant left subclavian artery. This particular comparison demonstrates an example of how differences in the regression of the embryonic aortic arches can lead to the presence or absence of a complete vascular ring. So let's start with the right arch with mirror image branching. In reviewing the embryonic model, you can see that the ascending aorta, the right arch, and the descending aorta are marked in red. The carotid arteries are orange, and the subclavian arteries are pink. This variant arises when the left dorsal arch and the left sixth arch regress, leaving the right arch with mirror image branch vessels. Here you can see the left-sided innominate artery. Rotating to view this from a posterior view, there are no structures to complete the vascular ring around the trachea or the esophagus. You can also see this when looking at the model from above. Although this variant generally does not form a vascular ring, 98% of patients with this anatomy have associated cyanotic congenital heart disease. Next, let's review the patient data set. Again, we maintain the same color scheme. The arch passes over the right bronchus, thus defining it as a right-sided aortic arch. You can see the branch vessels again exit in a mirror image pattern. The two red cylinders are possible insertion points for the ligamentum arteriosum that was not directly visualized on the CT scan, but implied by the deflection of the left subclavian artery. Looking at the data set posteriorly, you can again see that there's no vascular ring. Next, we will discuss the right arch with an aberrant left subclavian as another example of a complete vascular ring. This lesion originates from the persistence of the right fourth aortic arch and the left sixth aortic arch. The segment between the left carotid and the left subclavian artery regresses along with the right ductus. In reviewing the model, you can see that the ring is completed by the left PDA or ligamentum. Looking at the model from above, you can see that the arch and the duct form a complete ring around the trachea and the esophagus. We have colored the left subclavian and the left ductus in white as they aberrantly form the ring. Now let's move to the patient data set. Again, the arch passes over the right bronchus, defining it as a right-sided aortic arch. In this particular imaging data set, there are other common branch vessel variants, namely, the patient has a common carotid trunk with both carotid arteries sharing an origin. As you rotate to a posterolateral view, you can see that this patient had a patent ductus, which was well visualized on CT. The dataset demonstrates the formation of a complete ring with compression of both the trachea and the esophagus, leading to proximal dilation of the esophagus. You can also see the ring compression from a superior view. This is consistent with the patient's typical presenting symptoms, which I'll get to in a moment. In this lesion, the aberrant left subclavian typically arises from a retroesophageal diverticulum called Commerle's diverticulum. This is named after the first doctor to clinically diagnose a vascular ring in 1936. The diverticulum is a dilation at the base of the left subclavian, indicating the embryonic ductal insertion point. Consequently, the presence of a diverticulum is especially helpful in diagnosing a vascular ring in cases where the duct is not patent. This diverticulum is present in up to 60% of cases. Patients with the right arch with an aberrant left subclavian usually present with milder respiratory difficulties and swallowing dysfunction in late infancy. And although this is the second most common symptomatic vascular ring, some patients may not present until adulthood. In contrast to the right arch with mirror image branching, only 10% of right arch with aberrant left subclavian cases have associated intracardiac defects. Treatment of this lesion involves surgical division of the left ligamentum arteriosum. Many surgeons will leave the diverticulum alone due to the potential for surgical complications associated with resection. Other surgeons argue that the diverticulum should be resected and the aberrant left subclavian reimplanted onto the left carotid to form, in essence, a right arch with mirror image branching. This is to prevent future dilation of the diverticulum, requiring surgical reintervention. With that, we will pause our discussion here. In our next video, we will be discussing two incomplete vascular rings, the left aortic arch with an aberrant right subclavian artery, and the anomalous left pulmonary artery, also referred to as a vascular sling. Thanks for watching.